It really does help the person that's in the crisis.
Every day, Knoxville's co-response team is changing lives. Knoxville police officers and mental health advocates teamed up and they responded to 1,500 calls last year, including welfare checks on people experiencing suicidal thoughts and just general disturbances.
10 News reporter Grace King hears from supporters about the positive impact it's having across the city.
We know that criminalization of mental illness and addiction is out there, and we're trying everything that we can do to kind of deter that.
Studies show 1 in 3 Knox County inmates struggle with mental health. The co-response team from the McNabb Center and the Knoxville Police Department aims to change that.
If it's a medical crisis, as soon as an ambulance gets there, the better outcomes for that person. So same thing with the psychiatric crisis. As soon as we can get somebody to someone, the better we can help them.
Candace Allen with the McNabb Center says this program grew from 1 team at its start to 4 teams in 2022. They're now able to help people in crisis from 8 in the morning to 11 at night, 7 days a week.
The more that we do this, the more that we know how to effectively work better with people.
KPD says the co-response team has worked more than 2,000 calls. Most situations end with the person taken to the ER for evaluation. Half of them are then referred to resources or service providers. Fewer than 3% are arrested.
We're trying to be able to de-escalate situations because we're understanding what they're going through.
The officers are trained to handle those cases too.
They're CIT trained officers, which means they go through a 40-hour a week training to learn more about what mental illness and addiction are, and then how to kind of respond to that in a more positive way and helpful way.
That was Grace King reporting. The McNabb Center says it'd like to grow the co-response team so they can cover 24/7 help.